Angela. I'm a PA student at Duquesne University. Can I confirm your name and date of birth?
Christy Friedrich, February 16th, 99.
Nice to meet you, Christy. So today I'm going to be inserting a urinary catheter for you because you're undergoing a laparoscopic procedure. This is just protocol for what we do when you go under those kind of surgeries. So this is just going to eliminate you having to get up and go to the bathroom, and it makes things easier during the surgery as well.
Okay.
So you are going to feel a little bit of pressure and when I insert the catheter at first, but once the catheter is inserted, you shouldn't be able to feel it at all. And if you do, just let someone know, but you shouldn't feel anything after the procedure is done.
Okay.
So do you have any questions about the procedure?
Mm-mm.
Okay. So I have a few questions for you before we get started. Are you on any medications that are blood thinners like aspirin or Coumadin?
No.
And are you allergic to anything like latex, betadine, or adhesives?
No.
Okay. And have you had any trauma or surgeries to your urinary tract ever?
Mm-mm.
And are you currently having any bleeding or pain when you urinate?
No.
Okay. So we should be ready to get started. Do I have your permission to get started today?
Yes.
Okay. Okay, so now I'm going to wash my hands and I'm going to get my sterile kit ready. All right. And first I'm going to place the non-sterile drape underneath the patient. Just gonna have them lift up for me. And I'm going to have the patient get into the frog leg position so that the urethra is the most exposed. And then I'm going to don my sterile gloves. And now I'm going to take the sterile drape and I'm going to place it over the patient. All right. And now I'm going to prepare my kits. And I'm going to pour the iodine solution over the cotton balls. And I'm going to put the lidocaine into the tray as well. And I'm going to attach the sterile water to the catheter. And then I'm going to remove the catheter carefully from the casing. And I'm going to dip it in the lubricant the last few inches and place it back in here. And I'm going to put this back in, and I'm going to move my kit over here. And the bottom of it is no longer sterile, but the rest of the contents of the container are still sterile. So now I'm going to place my non-dominant hand on the patient, first on their inner thigh, warning them, and then I'm going to spread the labia. And first I'm going to clean the left side of the labia, the right side, and then I'm going to do 3 swipes down the middle to make sure that the urethra is clean. And I'm done with this container now. And now I'm going to warn the patient that they're going to feel some slight pressure, and I'm going to have them take a deep breath in and out as I insert the catheter. So take a deep breath for me. And as soon as I see some urine return, I'm going to insert it 1 to 2 more millimeters, and then I'm going to hold it with my non-sterile hand. And I'm going to flush the 10 milliliters of sterile water through the catheter. And then I'm going to remove the syringe and give it a little tug to make sure it's in place. And now I'm going to tape the catheter onto the patient's thigh. And I'm going to hang the bag from the table like that. And then I will be able to remove the drape from the patient. And I'm going to dispose of any potentially infectious materials into the biohazard, any sharps in the sharps container, and all the rest of the trash in the regular garbage. And I'm going to take my gloves off and wash my hands again. And then I'm going to let the patient know that if she notices any bleeding, any unusual smell of the urine, and if there's any pain or if there's any leakage from the catheter, that she should let someone know so that they can come fix it. And I'm also going to educate the patient to make sure that she doesn't try to remove the catheter by herself, because that could cause a lot of damage to the urethra. And that's it.